because, as you all know, Black and minority social workers and majority of the HSE, our main employer, is yet to develop or to publish, and even Koro, our registrar, to publish ethnic, data. Academically also, there is little or no data on Black, African, or racially minoritized practitioners in Ireland. So this research addresses a significant gap in understanding the professional lives of a growing and vital segment of the HSE workforce. The experiences reported by the Black African social workers, they echo those of other Black African healthcare workers. And as Siobhan has also said, aligning with those in civil service. Now, how they navigate workplaces that are predominantly white, rightfully, against a backdrop of contested migration and systemic anti-Black racism. So my study is not just an academic exercise. It's about ensuring that the HSE and employers of social workers and health and social care practitioners remain accountable to their commitment to social justice within the Irish context. Research focus. So my research focus and approach was principally centering the lived experiences. The theoretical framework underpinning my study is critical race theory. Critical race theory, because based on its principles, allows for the examination, analysis, and exploration of systemic issues as opposed to interpersonal circumstances and challenges and issues. So the central question was looking, what are the lived experiences of Koro registered Black African social workers? Maria, I think I'm on the third slide or fourth slide.
Thanks, Vicky. Yeah, we can move along.
I think is the next one, the research focus and approach, yes. So the methodology, of course, the power of a story, that saying aligns with one of the tenets of critical race theory, which is counter stories. So the counter story, if you to obtain their stories, their lived experiences, I undertook a semi-structured interview approach with 21 Black African social workers. The theoretical lens, which I mentioned, is critical race theory. And this helped to understand that racism did not occur and does not occur as isolated incidents, but as endemic, systemic, and deeply embedded. So this means that I sought to understand the subjective realities of the participants and to critically analyze how power within that dynamic and race operate. This theory, CRT, allowed me to move beyond individual acts of prejudice to examine how racism is a daily, systemic feature that shapes the institutions and the institution we work in. The social workers I interviewed they work across all health and social care service sectors, so not only HSC. So CRT allowed me to move beyond, individual acts and, attitudes and behavior, but also to understand and examine how racism daily occurs, is systemic, is inherent, and also how it shapes institutions and the professional lives of professionals or practitioners. So it's not just a series of unfortunate events. So I had 7 key findings, but for the purpose of this occasion, I'm going to just briefly outline 4 of those findings, 4 of the key findings. The first one is finding 1, yes. So if you look from the image there, I did a word. So I put all my interview, my transcript, the transcript interview of 21 social workers, Black African social workers. I put them in a Word, in an app that extracts keywords, and this is what I got. Racism is at the forefront. It aligns with the critical race tenet, that racism and systemic disadvantage is endemic, it's a daily occurrence. And under that, you will find microaggressions. Microaggressions are different forms of microaggressions. Micro insult is one of it. Overt racism, racial profiling. We're probably used to racial profiling when we're thinking about police, police generally, racial profiling people from underrepresented minorities. So it's not peripheral, but it is central. From my data, racism is central to the professional lives of Black African social workers in Ireland. Another sub-theme under this is the emotional and psychological toll of unpaid emotional labor and the racial battle fatigue. The central finding is that for Black African social workers, navigating systemic racism and disadvantage is not a peripheral aspect, but a core and defining one. They manifest as microaggressions, overt discrimination, and racial profiling. So a participant mentioned that it's like walking on eggshells because of the experience of racism. So they have to walk on eggshells to protect themselves. Constantly wondering if I'm being judged differently because of my race. It is exhausting, and it takes away from actual work I'm trying to do for service users. Bear in mind, for anyone to be a service user or a client of a social work service, they are in crisis. They need, they need support. So think about this word generator from the reports or experiences of the social workers. Another finding was how the power of intersectionality, how they are not just Black but men, women, migrants, and also people of faith, and how their combined identities, how they experience racial discrimination or discrimination based on the combination of their identities. One participant said, "You have to work twice as hard to prove my competence." This aligns with literature, one of the literature from UK, where Black practitioners and students expressed that they have to work hard, So this quote perfectly encapsulates the layered burden experienced by many, where their multiple identities lead to a constant demand for validation and exceptional and over the bar performance, just for them to be seen, acknowledged, or accepted as competent for the role. Siobhan mentioned institutional barriers. Yes, so from my study, institutional barriers and interest convergence. This third finding uncovers how institutions themselves contribute to the challenges that practitioners are already experiencing. My data revealed whiteness as a property, and professionalism comes under that. the use of, oh, you're not professional. What is, what is the contextualization of being professional? What does that mean? Um, where professionalism is racialized as white, leading to differential scrutiny and limited career progression for Black African staff. The quotes you can, this shares, my slides will be shared, and you can read the comments, the statements from participants. So, crucially, participants feel that the institutional barriers and interest convergence lead to what they describe as diversity initiatives that are highly visible yet thin on the ground. So, in relation to experiences of racism, participants, and I can, personally, I've worked in the HSE for more than a decade now. So we have robust mechanisms, we have robust systems. However, um, due to the lack of recognition of the impact of racial trauma, these mechanisms for addressing incidents in the workplace do not meet and resolve these issues for those who experience it. One participant mentioned the tick box exercise. Another quote that perfectly captures, the disillusionment. And because of this, you find that staff generally who experience racism do not report. So there is also an issue of underreporting, whereby superficial actions overshadow, genuine systemic change within within organizations. Um, so the fourth finding, resilience and empowerment. When we talk about counter stories, counter narratives, despite the profound challenges, my study highlights immense resilience. The data revealed significant, quite powerful resilience from Black practitioners. They've developed, from sophisticated coping mechanisms, affirming their identity, saying, and also going back to the reason, their motivation for studying social work, their motivation for deciding to continue to practice, to want to go into social work practice. And most poignantly is the support, is the support that they avail of, from other Black African colleagues, as opposed to the Irish Association of Social Work. Um, so the Black African colleagues, and also a collective, of African social workers called African Social Workers in Ireland, where over 80% of my participants are members of this collective, and also shared the experience and the benefits that they get from ASWE, if I can call it ASWE. So these networks are not just social groups, they are vital. They have evolved into vital spaces for professional survival, for sharing counter stories, counter narratives, and also for advocating for change. The network and the African groups that these practitioners align with or belong to, and they embody a commitment to cultural humility. I was delivering this morning to my colleagues who are practice educators, and advocating for cultural humility, moving away from color evasive approach, or previously known as colorblind, color evasive approaches, and embracing cultural humility, not cultural competence. This is about race. This is about race, This is about culture. Having cultural immunity, humility creates awareness, understanding, and sensitivity. Sensitivity to difference. The other, so if we are going to look at us as as a group, as a provider with a significant population of uh, staff, of key staff, of key staff from racial minority backgrounds or any other minoritized group. This study highlights, and also participants also voiced, they made suggestions about what they feel or how they've, in their view, based on their experiences of what Black and other racially minoritized staff should be able to avail of.
Sorry,
So,
Dr. Oluromade, I don't mean to cut across. Just I know we're running a small bit behind time.
yes.
Is there anything just maybe you'd like to add in the next minute or two, and then we can open it up for questions? And
Yes,
sorry again for cutting across.
this is my last piece. One, so mandatory CRT informed training, moving beyond cultural competence and color evasive approaches. It is important to establish safe and clear trusted pathways for reporting racism. These pathways or these mechanisms must be independent and insulated from local managerial influence to prevent victim blaming. Visible, accountable leadership. Without leadership, initiatives, approaches may not be, they cannot be effective. Most importantly, mandatory equality data collection. In the last slide, you will see I did a screenshot of the NHS workforce data. We have to have data. We have to be able to understand and have knowledge of the population that we are serving. So for the HSE, it is important for a workforce data to exist in order to be able to develop tailored and fit for purpose approaches and supports. So I mentioned the African social workers group, and because I know the benefits, as an educator teaching across three universities in Dublin only. I am very, very much aware of the benefits. I'm very much aware of the benefits of coaching, and I can say that exponentially the demography of these social work programs is increasingly diversifying. Black, Irish, Black international, Asians, they are they are higher. They are a higher population in these classes, in these programs. And going forward, they would be the ones working within the HSE and other organizations that employ health and social care practitioners. So it is the time now to begin to consider, to critically evaluate progression in relation to supporting Black and racially minoritized staff in the HSC. Thank you. I'm
Thank you so
happy to